Have you ever been told, good news, your labs are normal, but you still feel awful? Fatigue, brain fog, weight changes, pain. Something feels off, yet the workup stops. Let's talk about why normal labs don't always mean everything is fine. In medicine, lab tests are important, but they're not the whole story. When labs come back within range, symptoms can be dismissed too quickly. Things like stress, anxiety, and aging can be blamed, and the investigation ends. There's a name for this: premature closure. It's a cognitive bias where a clinician accepts a plausible explanation and stops looking for alternatives. When that happens, important diagnoses can be missed, not because someone didn't care, but because the process stopped too soon. Let's take thyroid labs as an example. A TSH of 4 might technically fall within the normal range, but what if it was 1.0 last year, and 0.7 the year before that? That trend tells a very different story. Single numbers are snapshots. Trends over time show direction, and direction matters. I also want to name another bias that doesn't get talked about enough, what I'd call cost-conscious bias. As healthcare providers, we face constant insurance denials, patient complaints about cost, and pressure to be efficient. Over time, that can push us toward the most cost-effective workup instead of the most clinically appropriate one, especially early on. Sometimes that restraint is appropriate. Sometimes it leads to undertesting and misdiagnoses. There's another consequence that's even more harmful: false reassurance. When patients hear, "everything looks normal," they often stop advocating for themselves. They start wondering if it's all in their head. They may delay care, sometimes for years. Many internalize blame and begin to believe their suffering is imaginary or their fault. Let me be clear. Normal labs do not mean you're imagining your symptoms. They often mean you need further evaluation, not less. So how do you advocate for better testing and interpretation? Ask about optimal ranges, not just normal ones. Request additional or alternative tests when symptoms persist. Bring data: symptom journals, prior labs, wearable or fitness tracker data. And yes, sometimes a second opinion matters. Good medicine is collaborative. Please remember you are more than your lab values. Labs are only one piece of the puzzle. Your symptoms matter. Your lived experience matters. Your intuition about your body matters. Medicine isn't about treating a printout. It's about treating a person. The future of good medicine isn't just better tests. It's better questions, deeper listening, and whole-person care. We're entering an era with incredible tools: continuous glucose monitors, wearable EKGs, smartwatches that track heart rhythm, blood pressure, sleep, oxygen levels, even fall detection. These tools don't replace doctors, but they empower patients and give us richer information than we've ever had before. And that's where medicine is headed: partnership, insight, and ownership of your health. Because normal should never mean ignored.